It's estimated that around 5% of children and around 2.5% of adults meet criteria for ADHD. Welcome back, Straight Talkers. Today I'm going to talk about the diagnosis Attention Deficit Hyperactivity Disorder and how psychiatrists go about making the diagnosis clinically. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. There are various diagnostic criteria that need to be met when making the diagnosis of ADHD. And when looking at the DSM-5, these criteria range from A to E. Criterion A is the longest and states that there needs to be a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. So let's break down these symptoms of inattention and hyperactivity impulsivity a little further. There are 9 total symptoms of inattention that we commonly evaluate for, and 6 or more need to be present for at least a 6-month period. And these symptoms need to be shown to have a negative impact on one's social, academic, or occupational activities. And for those that are 17 and older, only 5 of the symptoms are required. So the 9 symptoms include 1. Failing to give close attention to details or making careless mistakes in schoolwork, at one's job, or during other activities. 2. Having difficulty sustaining attention in tasks or play activities. And these tasks could include things like listening during a lecture or conversation, or having issues paying attention when trying to complete a lengthy reading. 3. Not listening when spoken to. Many describe feeling like their mind is wandering in conversations. 4. Not following through on instructions and failing to finish schoolwork, chores, or duties in the workplace. People will often start a task, but then they lose focus and get easily sidetracked. 5. Having difficulty organizing tasks and activities. And this can include having difficulties managing one task after another or sequential tasks. Others will struggle with keeping materials in order, being messy or disorganized, or having poor time management and failing to meet deadlines. 6. Avoiding, disliking, or being reluctant to engage in tasks that require sustained mental effort. And many parents describe their kids struggling with homework, especially when they have to prepare reports, complete forms, or review lengthy papers. 7. Losing things necessary for tasks or activities. And this can include things such as school materials, pencils, books, tools, wallets, keys, paperwork, eyeglasses, and the list goes on and on. 8. Being distracted by extraneous stimuli. And lastly, 9. Being forgetful in daily activities. And this can include various activities or tasks such as doing chores, running errands, returning calls, paying bills, or keeping appointments. In addition to the 9 symptoms of inattention, we also will screen for an additional 9 symptoms of hyperactivity and impulsivity. Again, 6 or more signs or symptoms need to be present for at least a 6-month period, and these symptoms need to be shown to have negative impact on one's social, academic, or occupational activities. And for those 17 and older, only 5 of the symptoms are required. The 9 symptoms include 1. Fidgeting with or tapping your hands and feet. Some kids will also be squirmy in their seats. 2. Leaving your seat in situations when remaining seated is expected. And this can include your child leaving their desk in the classroom or an adult leaving the desk in the workplace. 3. Running or climbing in situations where it's inappropriate. And parents often tell me that their children will dart in parking lots or in shopping centers. 4. Being unable to play or engage in leisurely activities quietly. Many kids will talk or sing to themselves, and parents will get frustrated by how noisy they always are. 5. Being on the go or driven by a motor. Sometimes I'll describe this one as if you're feeling like the Energizer Bunny, because many people will often feel uncomfortable being still for an extended period of time. So things like meetings, long lectures, or movies can be difficult to sit through. 6. Talking excessively. 7. Blurting out an answer before a question has been completed. A lot of children will struggle with this one. They'll complete other people's sentences, or they won't be able to wait their turn in a conversation and will start talking over others. 8. Having difficulties waiting his or her turn. And this is easily observable when we have to wait in line at like a grocery store or even an amusement park. And lastly, number 9, interrupting or intruding on others. And this can include things such as butting into conversations, games, or activities, using other people's things without asking or receiving permission, or even intruding onto others and taking over what someone is already doing. So if the various requirements from Criterion A are met, I'll then screen for Criteria B through E. And Criterion B states that symptoms need to be present prior to the age of 12 years old. And this criterion changed when the DSM-5 came out. Because previously in the DSM-4, it used to be that symptoms needed to be present before the age of 7 years old. Criterion C states that symptoms need to be present in 2 or more settings, such as one's home, school, or work environments. So if the symptoms are only present just at home, right, and no other environment, the diagnosis of ADHD isn't made. And what we'll do is we'll typically give parents rating scales for them and for teachers to fill out, because this will help confirm whether or not a child is struggling in the academic and the home environments. Criterion D states that there's clear evidence that the symptoms interfere with or reduce the quality of social, academic, or occupational functioning. Lastly, Criterion E states that symptoms do not exclusively occur during the course of schizophrenia or another psychotic disorder, and are not better explained by another mental disorder, such as mood disorders, anxiety disorders, dissociative disorders, personality disorders, or substance intoxication or withdrawal. Ruling out these other diagnoses is important because there's a lot of overlap in the signs and symptoms between them. And now the final thing that I typically discuss with families is the type of ADHD that is present if the patient is screening positive. And this is often still a place of confusion for many people because a lot of people will still want to separate out ADHD from ADD. And they often think that these are 2 separate diagnoses. However, now what we do is we just classify everything under ADHD. So the way that we distinguish whether symptoms are primarily those of inattention versus those of hyperactivity impulsivity is with the 3 different specifiers. So when looking at the diagnosis, what you'll typically see is some sort of wording such as ADHD predominantly inattentive presentation, or ADHD predominantly hyperactive impulsive presentation, or even ADHD combined presentation, which is when both symptoms of inattention and the hyperactivity impulsivity components are present. With ADHD being listed under the section neurodevelopmental disorders, we would expect to see symptoms start to appear in early development of a child's life. Many parents will tell me that they started seeing excessive motor activity in their child as a toddler, but it's really difficult to make a diagnosis of ADHD that early and prior to the age of 4 because symptoms can be hard to distinguish from behaviors that are developmentally normal. Now head on over to the next video to find out more ways that you can help your child live their best life.